For the devotees who are unable to make it physically and are viewing us online, either on YouTube or on Facebook. May Bhagwan bless us all. This morning, having concluded puja and as we are about to begin our satsang, we would have all come to the mandir with different thoughts in our mind, different circumstances even. But whatever be our particular situation, let us offer to Bhagwan our love, our adorations, and seek His blessings upon ourselves and our respective families, our community, and all of humanity. This morning is a very special service as we join in recognizing this month as the International Awareness for Breast Cancer. Our devotees, myself included, are dressed in pink to mark that occasion, as well as we will be having a very, very special discourse and message by Dr. Keshav Gyan later on in this morning's service. At this juncture, however, I invite us all to stand, and as we gaze at the murtis before us, as we customarily would do, I invite you to gaze at that form that you find particularly appealing, that form that you find most endearing to you. And having captured the image of that wonderful form in your mind, let us now close our eyes, the windows to this physical world, and go within as we engage now in pratna. Hari Om Shri Ganeshaya Namah Om Shri Saraswate Namah Om Shri Guru Charan Kamalebhyo Namah Vakratunda Mahakaya Surya Koti Samaprabha Nirvignam Kuru Me Deva Sarvakarishu Sarvada Jayanti Mangalakali Bhadrakali Kapalini Durga Kshama Shiva Dhatri Swaha Swada Namostute Vasudeva Sutam Devam Kamsa Chanuramardhanam Devaki Paramanandam Krishna Mandir Jagadguru Nagindra Haraya Trilochanaya Bhasmangaragaya Maheshwaraya Nityaya Shuddhaya Digambaragaya Tasmai Nakaraya Namah Shivaya Om Namah Shivaya Ramaya Ramabhadraya Ramachandra Mavedase Raghunathaya Nathaya Sitaye Pataye Namaha Om Manojavam Marutatulia Bhegyam Jetindriyam Buddhimatam Varishtam Vatatmajam Varadyutamukam Shri Ramadutam Shirishi Namami Om Shanti 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 Hari Om. Bhaidiye, let's resume our seats as we join together now with members of the group as we glorify Bhagwan. Let us join together, blending our voices.
Jai Jai Ganapati Jai Ganapati Jai Ganesh Jai Ganapati Jai 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 Ganapati Jai Ganapati Jai Ganesh Jai Ganapati Jai Jai Ganapati Vigna Vinashanhari Ganapati Vigna Vinashanhari Ganapati विनाशनहारी गणपति जय गणपति जय गणेश जय गणपति जय जय मोदक दीप दीप जननी जब ठुमक छलक नूपुर झनकारी मोदक दीप दीप जननी जब ठुमक छलक नूपुर झनकारी रिद्धि सिद्धि दो चवर दुलावत रिद्धि सिद्धि दो चवर दुलावत सुर समूह लखी होत सुखारी गणपति विघ्न विनाशनहारी गणपति विघ्न विनाशनहारी गणपति जय गणपति जय गणेश जय गणपति जय 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 गणपति जय गणपति जय गणेश जय गणपति जय 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 गणेश जय गणपति जय 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 गणेश जय गणपति जय जय
प्रेम से बोले श्री गणेश भगवान की जय. As we continue to glorify Bhagwan, we now engage in chanting together verses of Hanuman Chalisa as we offer our love or adoration to Mahabir Swami. Let us join together, blending our voices.
श्री गुरु चरण सरोज रज निज मन मुकुर सुधार वरनो रघुबर विमल जसु जो दायक फल चार बुद्धिहीन तनु जानिके सुमिरो पवन कुमार बल बुद्धि विद्या देहु मोहि हरहु कलेश विकार जय हनुमान ज्ञान गुण सागर जय कपीस तिहु लोक उजागर रामदूत अतुलित बल धामा अंजनी पुत्र पवन सुत नामा महावीर विक्रम बजरंगी कुमति निवार सुमति के संगी कंचन वरन विराज सुबेसा कानन कुंडल कुंचित केशा हाथ वज्र और ध्वजा विराजे कांधे बोझ जनेऊ साजे शंकर सुवन केसरी नंदन तेज प्रताप महाजगवंदन विद्यावान गुणी अति चातुर राम काज करिबे को आतुर प्रभु चरित्र सुनिबे को रसिया राम लखन सीता मन बसिया सूक्ष्म रूप धरि सियहि दिखावा विकट रूप धरि लंक जरावा भीम रूप धरि असुर संहारे रामचंद्र की काज सवारे लखन जियाए श्री रघुवीर हर्षि उर लाए रघुपति कीनी बहुत बड़ाई तुम मम प्रिय श्रीपति गंध लगावे कलिकानिक ब्रह्मादि मुनीसा नारद सारद सहित अहिसा वेद दिक्पाल जहाते कवि कोविद कही सके कहाते तुम उपकार सुग्रीव ही कीना राम मिलाय राज पर दीना तुमरो मंत्र विभीषण माना लंकेश्वर भय सब जग जाना युग सहस्र योजन पर भानु लील्यो ताहि मधुर फल जानु मोद्रिका मिले मुख माई जल दिलांगी गए अचरज नाई दुर्गम काज जगत के जेते सुगम अनुग्रह तुमरे तेते राम दुआरे तुम रखवारे होत न आज्ञा बिन पैसारे सब सुख लगे तुम्हारी सरना तुम रक्षक काहो को डरना आपने चीज तुम्हारो आपे तीनों लोक हाकते कापे भूत पिशाच निकट नहीं आवे महावीर जब नाम सुनावे नाशे रोग हरे सब पीरा जपत निरंतर हनुमत बीरा संकट से हनुमान छुड़ावे मन क्रम वचन ध्यान जो लावे सब पर राम तपस्वी राजा तिनके काज सकल तुम साजा और मनोरथ जो कोई लावे सोई अमित जीवन फल पावे चारों युग परताप तुम्हारा है प्रसिद्ध जगत उजियारा साधु संत के तुम रखवारे असुर निकंदन राम दुलावे अष्ट सिद्धि नवनिधि के दाता असबर दीन जानकी माता राम रसायन तुमरे पासा सदा रहो रघुपति के दासा तुमरे भजन राम को पावे जन्म जन्म के दुख बिसरावे अंधकार रघुवरपुर जाई जहाँ जन्म हरि भक्त कहाई और देवता चित न डरई हनुमत से सर्व सुख करई संकट कटे बीते सब पीरा जो सुमिरे हनुमत बलबीरा जय 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 हनुमान गोसाई कृपा करो गुरुदेव की नाई जो सत बार पाठ कर कोई छूट ही बंदी महासुख होई हनुमान चालीसा होई सिद्धि साखी गौरीसा तुलसीदास सदा हरि चेरा कीजे नाथ हृदय महादेरा कीजे नाथ हृदय महादेरा सुत हनुमान की जय।
ओम प्रेम से बोलो श्री गोविंद कृष्ण भगवान की जय। सीताराम everyone. We have this Sunday, we have next week Sunday, in the month of Kartik. It is a wonderfully powerful and auspicious month. Lovely to see you here, Ricky, Glenn. You know, what is beautiful about the month of Kartik is that it's a month that is dedicated to the pastimes of Krishna Bhagwan. You are aware of that, yes? And a lot of the time is spent in speaking about him and considering all of the different leelas that he would have engaged in to show us how much, even though as a little child, how much he loved us and loves us, continues to love us. And as we did last week, we had the Govardhan Puja, and I always point to the picture above Panditji's head. And it is a wonderful reminder that Krishna Bhagwan in complete form, is the savior, the refuge, the sanctuary, the home to which we all know that we need to resort to, especially when we feel alone. And this morning, I want us to sit for a few moments in meditation on Krishna Bhagwan. And as we look at him in his yellow dhoti, I will turn to look at him too. So we will describe him as we do his puja in our mind. And we go, Shyam teri bansi, Shyam teri bansi, pukare Radhana. लोग करे मीरा को यूं ही बदनाम. So that's what you're playing, right? And as we take a deep breath in and we hold it for a moment and then we let out. And in, hold, and all negativity out. And one more time, in, hold, and then out. Krishna Bhagwan, as we look at your beautiful feet, as we focus on you and your yellow dhoti, I have eyes only for you today. At this moment, nothing else is important. No phone call, no message. The only thing I want to hear is your bansuri, your voice calling out to me. Pukare Radhana. As I come to your chest, I see those beautiful gems on your chest. And I look at your hands, holding the bansuri. That represents me. That represents me, Bhagwan. I am the instrument of your love and of your consciousness, of your harmony, of your synchronicity with this entire universe. That is that instrument. And help me to be in harmony with you. And as you put that bansuri to your lips, smiling as they are, I listen to the call. सावरे की बंसी को बजने से काम, सावरे के बंसी को बजने से काम, लोग करे मीरा तो यूं ही बदनाम. And in your eyes, as I look at them and I focus only on you, I see the longing in your eyes for me to turn to you. I see the longing in your eyes for me to turn towards you undistractedly. And as I look at your beautiful crown with the feather on the top, I imagine that feather fluttering in the wind, but anchored in you. No matter what storm, no matter what breeze, no matter what wind, help me to always be anchored in you. And Prabhu, as I come down your arms again, I look at your hands, I close my eyes and imagine those hands hugging me, those arms embracing me and pulling me close to you, helping me to become one with you, helping me to feel your love and your grace and your blessing. You are my refuge. You are my home. You are home. And as I come down your dhoti once again, and I look at the ruffles, I look at each of them, perfect and imperfect, falling as they do. I too am imperfect at parts, Prabhu. But those imperfections, Prabhu, they are what make me, me. And I offer those imperfections to you. And I rest my eyes upon your feet, lifted as they are, showing us that little anchor. Oh, Jamuna की लहरें बंसी बजती छैया, किसका नहीं है कहो कृष्ण कन्हैया, श्याम का दीवाना हो, श्याम का दीवाना तो सारा ब्रिज धाम, श्याम का दीवाना तो सारा ब्रिज धाम, लोग करे मीरा तो इन्हें बदनाम, लोग करे मीरा तो इन्हें बदनाम, श्याम तेरी बंसी पुकारे, मेरा नाम, श्याम तेरी बंसी, कन्हैया तेरी बंसी पुकारे मेरा नाम, लोग करे मीरा को यूं ही बदनाम, लोग करे मीरा तो यूं ही बदनाम, श्याम तेरी बंसी पुकारे, मेरा नाम, लोग करे मीरा तो यूं ही बदनाम, लोग करे मीरा, लोग करे मीरा तो यूं ही बदनाम। ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय, ओम नमो भगवते वासुदेवाय, ओम नमो भगवते ओम नमो भगवते वासुदेवाय, ओम नमो भगवते Hey Govinda, as I come before you as your child, as we continue singing, I bow before you, I rest my forehead down at your feet. I ask you to fill me, Prabhu, in this holy month of Kartik. Whatever negativities I have come with, whatever troubles that are there in my heart and in my mind, in my life, with my family, with everything, Prabhu, I pray, I cry, I ask. Please remove them and fill me with you instead. Om Namo Bhagavate Vasudevaya, Om Namo
Bhagavate Vasudevaya,
Om Namo Bhagavate Vasudevaya. Prem Savoji Govinda Krishna Bhagavan ki. As we have done tonight, today, and on other days when you're at home, take the time to spend some time with Krishna Bhagavan. Last year, or was it year before, we had the 15-minute challenge. Do you remember that? To spend at least 15 minutes in meditation, in thought, in prayer, in silence, leaving everything else. Who remembers that? All right, and who did it? Continue to do it. So with that, I will leave now. I will pass you over back to Panditji. I see many of us are in pink. I didn't have my pink kurta. I have to get one. I have a red one. But it's a wonderful reminder month. And I know Bhai will be helping us through it and taking us through it. So to introduce that aspect of it, I will pass over to Panditji now.
Thank you very much, Panditji. Before I invite Dr. Mitra Maharaj to the introduction, I'll invite the teachers of the children's class to take the children to Balvihar. So all of the children, please move across with your teachers to the Balvihar class. And while they're doing so, I invite to the podium. So if you could have a mic placed by the podium. I invite Dr. Mitra Maharaj, who will do our introduction this morning of our very distinguished guest speaker.
Sitaram devotees. So today we continue with our series of discourses on the health-related issues that we do once a month here at the temple. And the idea, for those of you who are new, is that our health is our wealth. Our health is the most important thing that we have to take care of. And the idea is to raise awareness of issues that we face as humans on this earth and Hindus on this earth on a daily basis. This month is Breast Cancer Awareness Month, and I love to see the pink in the audience. And to give us a talk and to carry us through breast cancer, the screening, what can you do even if you have no symptoms, we have a devotee of our temple who is a medical oncologist and the head of the cancer center in Trinidad, in San Fernando, in South, the South Cancer Center. He's the head of department there, and I want to invite him to the podium, Dr. Keshav Gyan.
Good morning and Sitaram, everyone. Thank you very much, Mitra, for that kind introduction. And thank you very much to the Krishna Mandir for inviting me to speak to everyone this morning about a very important topic in commemoration of the month of October being Breast Cancer Awareness Month. My presentation today is entitled Breast Cancer Awareness, Screening and Early Detection, Empowering Lives Through Early Action. Breast cancer is a serious but often treatable disease, especially when caught early. And whilst the topic is serious, my goal this morning is to empower you with knowledge about screening and early detection, which can save lives. This morning, I aim to cover the importance of early detection, outline different screening methods, explain the significance of breast self-awareness, and provide clear action steps. So, what is breast cancer? Breast cancer is a disease where cells in the breast grow out of control, leading to the formation of a malignant tumor, which can quite often be felt. The female breast contains lobes, lobules, and ducts that produce and transport milk to the nipple. Fatty tissue gives the breast its shape, while muscles and the chest wall provide support. The lymphatic system, including lymph nodes, filter lymph and store white blood cells that help fight infection and disease. It can occur in both women and, yes, men as well, though it is far more common in women. And most breast cancers begin in the ducts or lobules. So why awareness matters? 1 in 8 women, and in countries such as the United Kingdom, 1 in 7 women will be diagnosed with breast cancer in her lifetime. Early detection improves survival rates significantly. The 5-year survival rate for localized breast cancer is 99%. Early detection often means treatment can be less invasive, involving smaller surgeries and potentially avoiding chemotherapy. Overall, finding cancer early leads to a higher chance of successful treatment and a better quality of life. Nevertheless, many cases are still diagnosed at late stages due to lack of awareness or barriers that prevent access to proper care. The pie chart on the left shows that breast cancer is the leading cause of cancer incidence and mortality in women in our beloved country, with 570 women being diagnosed in Trinidad and Tobago in the year 2022. The line graph on the right demonstrates the sobering reality that the incidence of this disease in Trinidad and Tobago will only increase in the years to come. So, next slide. So, let's understand what are our risk factors. So, risk factors are factors that increase your risk of developing breast cancer. So, common risk factors can include age, which increases in most cases in women over 50, family history, having a strong family history of breast cancer, especially with a first-degree relative. Genetics, mutations in certain genes like the BRCA1 and BRCA2 gene, and other factors such as a personal history of having had breast cancer, having dense breast tissue, obesity, alcohol consumption, and hormonal therapy. And these risk factors can be divided into non-modifiable risk factors, things we cannot change about ourselves, and modifiable risk factors, things that we do have control over, such as alcohol use, obesity, physical activity, and use of hormonal therapy. So let's move on to screening. What is screening? Screening means checking for cancer before symptoms appear. It helps detect cancer early when it's most treatable. And common methods of screening include the breast self-examination, also known as breast self-awareness, clinical breast examination, and mammography, often used together with ultrasound scans as an adjunct. So let's talk first about breast self-examination. What is it? Knowing how your breasts normally look and feel so you can easily notice changes. And when to check, it is best done monthly, and if you are still menstruating, check a few days after your period ends. And how do we do it? In your own private space, such as your bedroom or bathroom, look in the mirror and perform a visual inspection of the breasts with the arms in different positions. Above the head, just to the side, or on your waist, typical positions for the hands. And in those positions, visually inspect the breast for any abnormalities. Then, gently use the pads of your fingertips and manually move them across your breasts. The patterns of movement can vary from a wedge pattern, that is from the center moving outwards, in a vertical strip pattern up and down, or a circular pattern, either clockwise or anti-clockwise. You are free to decide which pattern works best for you. Breast self-examinations are not a substitute for mammography, but increases body awareness. So when you perform your examination, what are the signs and symptoms to look out for? Well, look out for any lumps or thickening in the breast or underarm. Look out for changes in size, shape, or appearance. Look for nipple changes, such as a discharge, which may be bloody, or nipple inversion. And look for skin changes on the breast, such as dimpling, redness, or scaliness. And if you detect any of these breast changes, please see a doctor right away. We'll move on now to the clinical breast examination. What is a clinical breast examination? It's a physical examination performed by a trained healthcare professional. Women in their 20s and 30s can have a clinical breast examination every 1 to 3 years. For women 40 or older, it can be part of an annual checkup. And why is it important? It serves as a professional second opinion and can detect abnormalities that a self-exam might miss. We'll now move on to mammography, which is considered the gold standard screening test. So what is mammography? It's basically a picture of the inside of the breast using a low-dose X-ray, and is considered the gold standard for screening. When to start? Well, the American Cancer Society recommends annual mammograms starting at the age of 45, with the option to begin at age 40. Annual screenings are typically recommended, but guidelines can vary. And what's new with mammography now? Well, you may hear of something called 3D mammography or tomosynthesis. And this type of mammography provides more detailed images and reduces false positives, especially for women with dense breasts. There are other screening methods as well too. Breast ultrasound uses ultrasound waves to differentiate between solid masses and fluid-filled cysts, often used as a follow-up or supplement to an abnormal mammogram. Breast MRI uses magnetic fields to create detailed images, reserved for high-risk women, example, women with a strong family history of breast cancer, and those with the BRCA mutations, and those with dense breasts, and is used in addition to, but not instead of, mammograms. So when should we start screening? So a woman in her 20s to 30s should have monthly breast self-examinations and have a clinical breast examination at least every 3 years. In the 40 to 49 age group, annual mammograms are recommended based on risk, and you can actually calculate your individual breast cancer risk by visiting the following websites: the Breast Cancer Risk Assessment Tool from the National Cancer Institute, and the Cancer Risk 360 Assessment Tool from the American Cancer Society. Both are available online. Ages 50 to 74 Mammograms are recommended every 1 to 2 years, and women 75 years and over, they can have mammograms based on their health and life expectancy. Women should talk with their physicians regularly, starting as early as age 25, about the individualized risk for breast cancer, as higher risk women may benefit from genetic counseling or early screening. So, what about the high-risk groups of women? BRCA1 or 2 mutations increase lifetime risk. Women with a BRCA1 mutation have a 55 to 72% chance of developing breast cancer in their lifetime, whilst women with a BRCA2 mutation have a 45 to 69% chance of developing breast cancer. And this is compared to the general population with a risk of around 12%. So, genetic counseling is recommended for those with a strong family history. An annual breast MRI may be used in addition to mammography for these high-risk individuals starting from age 30, and with some guidelines suggesting starting as early as age 25. So, what are some myths and facts about breast cancer screening? One common myth is that only women with a family history get breast cancer, when in fact 85% of cases have no family history at all, hence the importance of getting screened. People think mammograms are dangerous because of the radiation exposure, when in fact the radiation is minimal and safe. The radiation dose from a mammogram is very low, and the benefits of early detection far outweigh the minimal risk. A lump always means cancer. No, not necessarily. Most lumps are actually benign. People often think as well, mammograms are painful. Now, while there can be some temporary discomfort, modern technology has improved the experience, and the process is quick. People worry about false positives. This can happen, but often lead to additional tests and not immediate treatment, and can be managed. And often there's a myth as well that antiperspirants applied to the armpit may cause breast cancer. Currently, there is no evidence for this. So, what can you do to reduce your risk of developing breast cancer? That is, protective factors. Well, maintain a healthy weight, and if you are overweight, get to a healthy weight and keep it there. Eat healthy foods, fruits and vegetables. Stay away from ultra-processed foods, especially with high sugar content. And Pandit Dev spoke to you about that already. So, as part of our religion, no salt, quote unquote, no salt fasts are not an excuse to load up on refined sugars and carbohydrates. Limit alcohol and avoid smoking or vaping. Stay physically active, exercise regularly, and breastfeed if possible when you have a newborn. So, what can we do right now? Know your risk. Be breast aware. Practice monthly self-breast examinations to notice any changes in your body. Talk to your doctor about screening based on your age and risk factors, and encourage loved ones to get screened. Share information with friends and family. Encourage them to be proactive about their breast health, and support awareness campaigns in your workplace and community. So, some final thoughts. Early detection saves lives. Screening is simple, safe, accessible, and effective. Together, let's break the silence and spread awareness. Let's turn awareness into action. And that's it for my presentation. Thank you very much for your attention. I'll be happy to answer any questions you may have at this time.
Testing on.
Sitaram, I'd just like to find out, you mentioned the genetic testing? What's the cost like for that kind of testing?
So there are labs in Trinidad and Tobago that offer the testing. The genetic testing can be done as a saliva test or blood test. If I'm not mistaken, a blood test may cost in the area of around $2,000 to $3,000. The sample has to be sent abroad with an affiliate lab, and then within 2 weeks' time, the result is obtained. There are actually pharmaceutical companies that offer free testing for patients in the hospital setting currently.
Sitaram, Dr. Gyan.
Sitaram.
You mentioned that men also suffer from breast cancer. How prevalent is this, or is this a rare occurrence?
So it is rare, but we've seen several cases in our clinic. And while the incidence for breast cancer women may be 1 in 8, sometimes even 1 in 7, the incidence for male breast cancer is usually in 1 in 1,000. So it's much rarer, but nevertheless, we do see a few cases every year presenting itself. So men must, I can't stress enough, men must also be breast aware. Yeah.
It's a surprising fact.
And actually, because male breast cancer is not regularly screened for, it's picked up at a later stage and actually behaves quite aggressively as well. So that's why it's important, even for a man, if you feel any lump on your chest or any lump in your armpit, talk to a doctor right away.
My other question is, with women who are going through the menopausal stage there, when they have to take, I don't know which one is recommended, the estrogen or the progesterone tablet, does this taking of those tablets or those medications there to replace the loss, does that increase the risk factor of women getting cancer at that stage?
Yeah, excellent question. Hormone replacement therapy is quite often necessary and may be prescribed by an obstetrician gynecologist to women who are experiencing severe menopausal symptoms. There is an increased risk of breast cancer if you are taking hormonal replacement therapy, especially if it is estrogen-only hormone replacement therapy. So hormone replacement therapy does increase your risk of breast cancer, so have a discussion with your doctor if he or she recommends hormone replacement therapy for you for your menopausal symptoms. The same applies for the oral contraceptive pill in younger women, especially estrogen-only oral contraceptive pills, so weigh the benefit and the risk and have a detailed discussion with your healthcare provider about either the either HRT, hormone replacement therapy, and even the oral contraceptive pill. Yeah.
Thank you.
Yeah.
Hi, Sitaram.
Sitaram.
My question is, you mentioned that for women with dense breast tissue, it's a higher risk. Does that mean you also highlighted the routine in terms of early screening and how often you should? Does it then mean that for a woman with dense breasts that you should be screening more often than regular, or is it not? Does it have to be accompanied by the other risk factors for you to have screening more regularly than outlined in your?
Yeah, again, an excellent question. So women with dense breasts, when they should go through the routine screening recommendations. However, when a woman with dense breasts has a mammogram, often dense breast tissue appears white, and a malignant tumor also appears white. So it can be hidden within the breast tissue in women with dense breasts. That's why a woman with dense breasts must undergo a supplemental ultrasound scan under the trained eye of a radiologist so as not to miss anything on a routine screening mammogram. And especially if a woman with dense breasts has a positive family history of breast cancer, then we escalate to more intense screening, such as having an additional MRI on an annual basis and so on. So women with dense breasts, remember that in addition to your regular screening mammogram, there may be supplemental tests that your doctor may want to do, just to make absolutely sure that nothing is missed. So, sorry? Right. So actually, she's asking about what are the local statistics with regard to women who actually are treated and cured of breast cancer and go into remission. So you can access local Trinidad and Tobago data on the World Health Organization website. There's a website called the GloboCan, or the IARC, International Association for Research on Cancer, and they have cancer statistics based on region and country, and there are statistics based on in Trinidad and Tobago. To answer your question more specifically, in terms of my experience and experience at the cancer center, unfortunately, as much as 40 to 45% of cases that we see present as either stage 3 or stage 4, meaning the cancer has already spread to the lymph nodes and or the rest of their body. Hence, early stage cancer, such as stage 1 and stage 2, are quite often, unfortunately, not picked up. Hence, the reason why we are stressing and campaigning for early screening. But yes, I would say if the cancers are picked up at a stage 1 and a stage 2 level, which represents about at least 30% of the cancers that we see in the clinic, then the cure rates are actually quite high. Survival rates are in the 90s at a 5-year survival or a 10-year survival rate. Does that answer your question? Yeah? But generally speaking, if you go onto the website, our annual diagnostic rate, so to speak, or incidence is actually about 3,000 women every year may be diagnosed with breast cancer. So the statistics are quite alarming, and hence the reason why early detection, screening and early detection actually improve outcomes, improve cure rates, and save lives. So this is a campaign that we are embarking upon to advocate for change, because quite often, by the time a woman picks up symptoms and a stage, the cancer is often caught at a later, locally advanced stage or even a metastatic stage. Yeah.
Focal mic on the harmonium.
Testing.
So, Dr. Gyan, mine is more of a comment than a question. As a woman in Krishna Mandir, I have to pile on the praises for Dr. Mitra Maharaj and yourself for bringing this very interesting topic to the fore and bringing the importance of screening to all of us here. And I hope to all the people who are looking online. I actually received a WhatsApp just now from someone who's viewing in Canada, and they said they sent this, I'll read the WhatsApp, and it's what it says. It says, sorry. This morning on Krishna Mandir, San Fernando, Trinidad's live feed is an excellent presentation of breast cancer self-examination and all the things that we all should know. I'm strongly suggesting that you all look at this on YouTube, because this young doctor did a great job for all. And this person is male.
Well, thank you very much for the kind words. Sitaram.
Okay, so what I wanted to find out is can people go to the hospital to get this done free? Because if, like, we have people who cannot afford this, you go to a GP, get a prescription, then you have to go to a medical center, get it done, pay, and then go back to the GP again for them to explain your results. All of it, 3 steps cost.
Yes.
So can you get it done free?
Yeah, thank you very much. Again, an excellent question. So, screening tests are available in our public healthcare system. Having said that, our public healthcare system, especially with regard to radiological resources such as ultrasound, X-rays, CTs, MRIs, mammograms, they are already overburdened with a lot of clinical work, whether it be cancer-related or non-cancer-related. But yes, if you speak to your doctor at your local health center, they can refer you to a tertiary institution that can have, where you could have access to mammograms, CT scans, and MRI scans. So yes, they are available free of charge in the public healthcare system. The issue is time. Cancer is time dependent. And if tests have to be done, they have to be done in a timely manner. You can't ask a woman to wait several weeks to months just to get an appointment for a suspicious breast lump to be investigated. That's not right and that's not fair. But the stark reality is that our public healthcare system is quite overburdened. Now, given that time will be of the essence, I advise, if resources permit, then get your investigations as recommended by your doctor on the outside or privately, resources permitting. However, the good news is that there are NGOs, and I wish to pay special mention to the South Cancer Support Group, where they offer screening tests at a subsidized price. So you don't pay the full cost you would pay in a private medical center or nursing home, for example. I actually have some educational pamphlets, courtesy the South Cancer Support Group. They're available outside for you all to collect and read. And basically, the South Cancer Support Group will offer these said screening tests at a subsidized price. Not free, but subsidized, which I think is the next best thing than having it done in the public healthcare system for free in a timely manner. So the answer is yes, they are available free of charge in the public healthcare system. The issue we quite often have is the appointment scheduling or getting an early appointment. But however, the Minister of Health understands our situation. He has spoken to us, he has heard us, and more resources are being developed towards a national screening center whereby cancers, the top 3 cancers in our country, prostate cancer, breast cancer, colorectal cancers, all these cancers could be screened for, but yet they are the leading cause of cancer mortality in our country. My proposal is to have a national screening center free of charge to the public, funded by a national cancer screening fund. We hope that the administrators and people who control the public purse recognize the need and devote resources towards this. Yeah.
I know of someone who went to check on it, and the GP said, okay, well, because it's Cancer Awareness Month, that these institutions, medical centers, will have discounts or should have discounts, but that is not so. So nobody is encouraging people to do these things in terms of the medical centers.
So for Breast Cancer Awareness Month, there are advertisements you will see on conventional media, social media, advertising for special discounted rates. Do your research and see if that is actually true or not. Unfortunately, a lot of these things may be promotional, and it's all about marketing and so on the hype of Breast Cancer Awareness Month. But I will say NGOs, the Trinidad and Tobago Cancer Society, the South Cancer Support Group, they do in fact offer subsidized rates for screening tests. The nursing homes, you will have to do your research and see if it is in fact that the prices are reduced or subsidized for the month of October. If they are not, then I would advocate seeking access to NGOs such as the Trinidad and Tobago Cancer Society and the South Cancer Support Group. They both do excellent jobs. Yeah.
All right, so I think we have had sufficient. Is there one more? Okay. We've had a really wonderful discourse this morning and conversation, and I'd invite you to give Dr. Gyan a round of applause.
Thank you very much.
He is indeed one of our own and a pillar in society, particularly his work that he's doing with the Regional Health Authority and the Cancer Center in South Trinidad. I listened attentively to the questions that were asked, and while it is true that in a developing country like Trinidad and Tobago, where resources are always finite and they're always spread across competing demands, there are many challenges that we still face, one of which I wouldn't put doctor on the spot. So sometimes you have the detection, albeit that the timeliness may not have been there, but then sometimes there's a fall down with regard to the continuity of the treatment. Again, no faults to the professionals, but we witnessed recently, for example, there was a challenge in Port of Spain and St. James with regard to the mixing of the drugs that were required, and then they had to move back and forth between Port of Spain General and St. James. So it really requires you as a patient to seize ownership of your situation, to manage your situation with the assistance as best as you can. And there is a lot of assistance that may be available through NGOs as well. But it's important to my mind to be very, very vigilant and very watchful and very proactive in all aspects of your health. And I think that is the message that is being resonating, because I will share this as well. Toronto's healthcare system is not much better than Trinidad and Tobago. You have to wait several months sometimes just to get an appointment from a professional. So as much as we would say that there's a lot that is missing in Trinidad and Tobago, we are unfortunately not unique in that regard, and that occurs in other parts of the world as well. So being mindful, being aware, and taking ownership of your situation in a proactive way will also go a long way in ensuring that your survivor rate increases as best as possible. So I want to thank Dr. Gyan as well on behalf of all of the members and families, both present and those looking on. I want to commend Dr. Mitra Maharaj for these ongoing messages. And sometimes, Panditji will tell you as well, sometimes we get the questions, is that really something that you should be talking about in a mandir? And unequivocally, our position here at Krishna Mandir is definitely it is something and matters that we should be speaking about and speaking to our devotees and the wider community about. So having said that, we will be having these conversations going forward again for the remainder of this year and next year as we continue to ensure that our devotees preserve their health and are mindful and share the message as well with others. We are now inviting you to come forward to perform your arati as individuals, as family members, while I hand over to the group for Kirtan.
Jai Shiva, Jai Shiva, Jai Shiva, Jai Shiva, Shiva, Jai Jai Shiva, 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 Shiva, Jai Jai Shiva,
Jai Shiva, Shiva, Jai Jai Shiva.
Shankar Gauri Nath Parvati Pati Bole Nath.
Jai Shiva Shankar
प्रजापति कैलाशपति भवभय भंजक मायती
गिरिजापति कैलाशपति भवभय भंजन महायति
तेरे गुण गाता हर रोम
तेरे गुण गाता हर व्योम
जय शिव शिव जय जय शिव ओम।
जय शिव शिव जय जय शिव ओम
नीलकंठ गत गत वासी रुद्रदेव हर अविनाशी
नीलकंठ गज गज व्यासी रुद्रदेव हरि अविनाशी
मस्तक पर शोभित है श्लोम
मस्तक पर शोभित हर व्योम
जय शिव शिव जय जय शिव ओम।
जय शिव शिव जय जय शिव ओम
जय गंगेश उमेश महेश विनती करे भक्त आदेश
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 सोनाख बीननाथ विलोम
शोभा कबीरनाथ विलोम
जय शिव शिव जय जय शिव ओम।
जय शिव शिव जय जय शिव ओम
जय शिव जय शिव जय शिव ओम।
जय शिव जय शिव जय शिव ओम
ओम जय शिव जय शिव जय शिव ओम।
जय शिव जय शिव जय शिव ओम
जय शिव शिव जय जय शिव ओम।
जय शिव शिव जय जय शिव ओम
जय शिव शिव जय जय शिव ओम।
जय शिव शिव जय जय शिव ओम
राधे गोविंद गोपाल जय गोविंद राधे गोपाल
राधे गोविंद गोपाला जय गोविंद राधे गोपाला राधे गोविंद गोपाला जय गोविंद राधे गोपाला
राधे
जय गोविंद राधे गोपाला
गोविंद गोविंद 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 गोपाला
जय गोविंद गोविंद गोपाला
जय गोविंद गोविंद गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
कृष्णा मधुसूदना मधुसूदना कृष्णा
कृष्णा मधुसूदना मधुसूदना कृष्णा
कृष्णा मधुसूदना मधुसूदना कृष्णा
कृष्णा मधुसूदना मधुसूदना कृष्णा
गोपाल गोपाल गोपाला
गोपाल गोपाल गोपाला
जय गोपाल गोपाल गोपाला
साई गोपाल गोपाल गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
गोविंद गोविंद गोपाला
गोविंद गोविंद गोपाला
गोविंद गोविंद गोपाला
गोविंद गोविंद गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
कृष्णा मधुसूदना मधुसूदना कृष्णा
कृष्णा मधुसूदना मधुसूदना कृष्णा
गोपाल गोपाल गोपाला
गोपाल गोपाल गोपाला
साई गोपाल गोपाल गोपाला
साई गोपाल गोपाल गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
जय गोविंद राधे गोपाला
जय गोविंद राधे गोपाला
राधे गोविंद गोपाला जय गोविंद राधे गोपाला
सुन्दर नयना रामा सुन्दर नयना रामा
सुन्दर नयना रामा सुन्दर नयना रामा
सुन्दर
सुंदर नयना रामा
जय जय रामा जय रघुरामा
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 सुंदर नयना रामा सुंदर नयना रामा
सुंदर नयना रामा सुंदर नयना रामा
जय जय रामा जय रघुरामा
जय जय रामा जय रघुरामा
राम राम साई राजा रामा
राम राम साई राजा रामा
त्रिभुवन सुंदर रामा रघुकुल तिलका रामा
त्रिभुवन सुंदर रामा रघुकुल तिलका रामा
सुंदर नयना रामा सुंदर नयना रामा
सुंदर नयना रामा सुंदर नयना रामा
जय जय रामा जय रघुरामा
जय जय रामा जय रघुरामा
राम राम साई राजा रामा
राम राम साई राजा रामा
रामा साई रामा
राम साई रामा
रामा साई रामा
राम साई रामा
रामा साई रामा
राम साई रामा
रघुरामा रघुरामा रघुरामा
रघुरामा
त्रिभुवन सुंदर रामा रघुकुल तिलका रामा त्रिभुवन सुंदर
रामा रघुकुल तिलका रामा
सुंदर नयना रामा सुंदर नयना रामा
सुंदर नयना रामा सुंदर नयना रामा
सुंदर नयना रामा
सुंदर नयना रामा
We'll have our final bhajan now.
वीर हनुमान अति बलवान राम राम रसिया रे प्रभु मन बसिया रे
वीर हनुमान अति बलवान राम राम रसिया रे प्रभु मन बसिया रे
वीर हनुमान अति बलवान राम राम रसिया जय बोलो हनुमान की।
राम लक्ष्मण जानकी जय बोलो हनुमान की।
राम लक्ष्मण जानकी जय बोलो हनुमान की।
राम लक्ष्मण जानकी जय बोलो हनुमान की।
वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीर हनुमान अति बलवाना राम राम रसियाए। प्रभु मन बसियाए।
रघुपति राघव राजा राम पतित पावन सीताराम।
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 वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीर हनुमान अति बलवाना राम राम रसियाए। प्रभु मन बसियाए।
सीताराम जय सीताराम राधे श्याम जय राधे श्याम।
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 वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीरा हनुमान अति बलवाना राम राम रसियाए। प्रभु मन बसियाए।
राम लक्ष्मण जानकी जय बोलो हनुमान की।
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 वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीरा हनुमान अति बलवान राम राम रसियाए। प्रभु मन बसियाए।
रघुपति राघव राजा राम पतित पावन सीताराम।
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 वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीरा हनुमान अति बलवाना राम राम रसियारे। प्रभु मन बसियारे।
वीरा हनुमान अति बलवान राम राम रसियारी प्रभु मन बसियारी।
वीरा हनुमान अति बलवाना राम राम रसियारे। प्रभु मन बसियारे।
We'll now have our announcements. Dr. Mitra Maharaj.
Sitaram devotees. So first of all, welcome to each and every one of you. Welcome to those of you who are here for the first time and those of you who are here from after some period of absence. Special welcome to each and every one of you to the Krishna Mandir Sunday service. For those of you who wish to make donations to the temple, whether it be in cash or kind, can see Uncle Gangadine in the office in the back after service. And for those of you who wish to perform puja on a Sunday morning, can also see Uncle Gangadine or Auntie Rama after service to put down your names to do so. Anyone celebrating their birthday this week? No, your birthday is in August? Yes, Arya's birthday and Amral's birthday was last week, so we want to wish them special happy birthday. Amral wasn't here last week, so I had to say it now. We want to wish them special happy birthday, and anyone else who's celebrating their birthday or anniversary this upcoming week. There are just a couple events that we still have upcoming. One is Hanumanji Puja, which is on this Saturday, the 1st of November at 8 a.m. right here at the temple. So for those of you who wish to come and join puja, everyone is invited. It is 8 a.m. on this Saturday, the 1st of November. On Sunday, the 2nd of November, we are celebrating Kartik Snan at Mayaro. A devotee has lent us their house in Mayaro, and we are arranging transportation for anyone who wishes to use transportation from here to the destination. So if you all want transportation, please see Uncle Gangadine again in the office after service to put down your names to do so. It is free of charge for the transportation. And we're meeting here for 7 a.m. 7 a.m., right? We're meeting here for 7 a.m. and leaving at 7:30 to head down to Mayaro. In addition, we have Gita Jayanti, which will be held on the 30th of November. So this is advance notice. The 30th of November, right here at the temple, we are inviting devotees who wish to come and read a chapter from the Bhagavad Gita. It will be in English. So for families, kids, and even the older ones, we invite you to come and support us in that Gita Jayanti. More details will come later throughout the month. We want to say a special thanks to Dr. Gyan this morning, who gave us that excellent discourse. The token, I left it on my kitchen counter as I walked through the door, so I'll arrange that to you later. I just want to emphasize on his point, Daria. Right, I just want to emphasize on his point of early detection and screening. This was actually a case that we posted yesterday from our foundation, Social, and is someone who actually was very close to me and who came to a health fair, a medical clinic that we hosted. She had no symptoms whatsoever. She came just because it was a free health fair. She wanted to see the doctors. She was actually diagnosed, a breast lump was picked up at the breast examination station. And she went on to be diagnosed with stage 2 breast cancer. She had surgery, chemotherapy, and radiation therapy, and now is in remission. And that is the story of someone who gets early detected, and it's been about 2 years. And that process has went on, and now she is in full remission of the cancer. She was treated by Dr. Gyan and team at the San Fernando General Hospital, actually. So I mean, just to emphasize on the point, she actually wanted to share the story with the community and share her story and just raise the awareness of what is early detection and what it can lead to. I just a last plea to everyone to join our WhatsApp channel and our WhatsApp broadcast list. You could see Roger to give your numbers to him. He can add you to the broadcast list, and you can subscribe to our WhatsApp channel as well, and all our social media pages to keep updated with all these announcements that I say here on a Sunday. We just have one final announcement, and I'll invite Uncle Din to carry us through that. But in the meantime, everyone enjoy the rest of your week and have a safe and enjoyable one. Sitaram.
Thank you, Dr. Petra. Sitaram, everybody. Excuse my voice a little bit under the weather. Daryl, will you be kind enough to put up the picture, please? Today we want to highlight this young lady. Most of you wouldn't know who the young lady is, but I'll try my best to explain. Her name is Krishna Rajkumar. She's from a little village in Cedros called Ikakas. Ikakas is the last village to the southwestern peninsula. After Ikakas is Venezuela. It is also the village where I born and grew up. Krishna came from a very humble upbringing. Her father is a laborer at the Superior Borough Corporation. Her mother is a housewife who would normally make puloris and aloo pies and cakes and pastries to help supplement the income of the family. Krishna would have passed for Vesini Secondary, where she excelled. And it's at Cape that her life turned, and she was shown into the spotlight when she was afforded a National Open Scholarship. So for a little girl from Ikakas in Cedros, it was quite an accomplishment for the village at that point in time. And during one of her interviews with the press and the media, it was highlighted and asked of her what are some of the challenges that she had in reaching thus far. And she highlighted two. One was transportation, having to take 2 to 3 maxis to reach Vesini, and in the return in the afternoon. For those of you who don't know where Vesini is between Point and Labre. It's closer to Labre. So she would leave home at wee hours in the morning and reach home at wee hours in the night. Her second challenge was that she studied at Cape without a laptop. She used her phone. Normally, she and her sister would share the phone. The then chairman, Mr. Maldeo Maharaj, who's a stickler for education, reached out to me and said, then we need to do something for this young lady. She's a daughter of the soil. So I reached out to the family and told them what we wanted to do. We wanted to donate a laptop to her, and they graciously accepted. We were able to procure the laptop and brought her to the Mandir, where we had a little simple ceremony and presented it to her, and she was very grateful. The highlight of it is on Friday gone, this young lady graduated from the University of the West Indies St. Augustine campus, Faculty of Social Sciences, with a BSc in accounting. She not only graduated, but she graduated with first-class honors. And, you know, if that wasn't enough, she also was the most outstanding student in her degree program. So she received both awards from UE. She was also the most outstanding student in taxation, and she was given an award by Ernst & Young. And she was also the most outstanding student in auditing, also given an award by Ernst & Young. So Krishna is a shining example for young ladies and young people alike that with hard work and dedication, you know, anything is possible. Krishna wanted to extend her heartfelt thanks and gratitude to the members of the Krishna Mandir for their kind generosity towards donating the laptop to her, which went a long way in her fulfilling her academic accomplishment. We at the temple will also like to wish her all the best thus far, and to wish her all the best in her future endeavors. Thank you.
Thank you very much, Dindyal. And again, that testimony, a very real-life one, as the one shared by Mitra, Dr. Mitra Maharaj, shows that sometimes interventions in our community and to our persons in Trinidad and Tobago can have a very meaningful impact in a very positive way on their lives, both Mrs. Kisoon and we've just seen Ms. Rajkumar. So we want to continue to endorse the prospect of giving, even sometimes when it hurts, because you never know how what you give makes a substantial difference. Let us all now stand as we conclude with Arti and final prayer. And just a reminder, next week Sunday, if you show up at the Mandir, we won't be here. We will be down at Meyaru. So please be mindful of that, because every year we have one person coming saying, what's happening? And that one person was not there the weeks before. So just be reminded, share that information. Feel free to join us as we engage in puja down at Meyaru. We stand for Arti.
Om Jai Jagadish Hari Swami Jai Jagadish Hari Bhakt Jano ke sankat Das Jano ke sankat Kshan mein dur kare Om Jai Jagadish Hari फल पावे दुख बिन से मन का स्वामी दुख बिन से मन का सुख संपत्ति घर आवे सुख संपत्ति घर आवे कष्ट मिटे तन का ओम जय जगदीश हरे पिता तुम मेरे शरण गहूँ किसकी स्वामी शरण गहूँ किसकी तुम बिन और न दूजा तुम बिन और न दूजा आश करो जिसकी ओम जय जगदीश हरे तुम पूरन परमात्मा तुम अंतर्यामी स्वामी तुम अंतर्यामी पार ब्रह्म परमेश्वर पार ब्रह्म परमेश्वर तुम सबके स्वामी ओम जय जगदीश हरे तुम करुणा के सागर तुम पालन करता स्वामी तुम पालन करता हम सेवक तुम स्वामी हम सेवक तुम स्वामी कृपा करो भरता ओम जय जगदीश हरे तुम हो एक अकोचर सबके प्राणपति स्वामी सबके प्राणपति इस विधि विरोधया में इस विधि विरोधया में तुमको मैं कुमति ओम जय जगदीश हरे दीन बंधु दुख हरता तुम रक्षक मेरे स्वामी तुम रक्षक मेरे अपने हाथ उठाओ अपने हाथ उठाओ द्वार पर तेरे ओम जय जगदीश हरे ओम जय जगदीश हरे स्वामी जय जगदीश हरे भक्त जनों के संकट दास जनों के संकट जन में दूर करे ओम जय जगदीश हरे ओम जय जगदीश हरे ओम जय जगदीश
Hari Om. As we conclude our puja and our satsang this morning, O Lord, we come before you with all humility, with all love and all affection. We ask for your continued blessings upon ourselves, our family, our community, our country, and indeed all of humanity. For persons who may have lost loved ones, we ask you to provide them with that solace and with that strength. For persons who are ill or afflicted in some way, we ask you to provide them with that healing touch that they would recover from their ailments. And for those individuals who are engaged in acts of criminality and deviant behavior, we ask that you redirect their minds and their actions away from that pathway and instead closer to you. For you are mother, you are father, you are family, you are friend. You are knowledge, you are wealth, you are everything to us. We pray to you with all love. Hari Om. Tvameva Mata Cha Pita Tvameva Tvameva Bandhu Cha Seka Tvameva Tvameva Vidya Dravinam Tvameva Tvameva Sarvam Mama Deva Deva Om Sato Ma Sadgamaya Tamaso Ma Jyotirgamaya Mrityurma Amritam Gamaya Om Shanti 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 Hari Om. प्रेम से बोले श्री गणेश भगवान की जय, मापति महादेव की जय, वृंदावन बिहारी लाल की जय, आज शक्ति जगदम्बा देवी मैया की जय, श्री पवन पुत्र हनुमान की जय। प्रेम से बोले श्री सत्य सनातन धर्म की जय। To those around you, sab koi jai jai Sitaram. Have a very powerful, a very productive week ahead, and we see you all next Sunday at Mayaro for Puja. Jai Sitaram all.